Namaskar, hello and welcome. I am Dr. Monika Bhatia, Head of Obstetrics and Gynaecology at Venkateshwar Hospital, Dwarka. And in this video, I want to talk to you about endometriosis. Now, endometriosis is a very common disease. It affects millions of women worldwide. So to understand what is endometriosis, let's first understand what is endometrium. So endometrium is that tissue which lines the inner wall of the womb or the uterus or the bachitani we call it. And every month cyclically under the influence of hormones, this lining swells up and makes a bed for the baby. And in case no pregnancy happens, then this lining is shed in the form of periods. Now when tissue similar to this lining is present outside the uterus, then we call it endometriosis. So most commonly this tissue is present on the back surface of the uterus, on the tubes, on the ovaries. So what happens is every month cyclically when hormones come, this tissue is also going to swell up and it's going to bleed internally. This will lead to chronic inflammation, scarring and adhesion formation and formation of cysts in the ovaries. These cysts are called chocolate cysts. So this progression of this disease can vary from a woman to woman, and in some women it can remain only in the deposit stage, and then it is called mild endometriosis. However, for some women it may become rapidly progressive and lead to a lot of damage to the reproductive organs. Then it is called severe endometriosis. So let us understand what symptoms does it cause. So majorly it causes two types of symptoms: difficulty in conceiving and pain. Now this pain can be pain during periods, pain during intercourse, pain with bowel and bladder movements, or pain otherwise. Initially, to start with, this pain can be cyclical, happening only around periods, but later it can become constant when the disease becomes more severe. Now what is interesting to note that the severity of the disease may not exactly correlate with the severity of symptoms. So very severe women with very mild endometriosis can have very severe symptoms, and women with minimal severe endometriosis can have no symptoms at all. So how do we diagnose it? Now diagnosis again can be difficult in this condition because the symptoms can be variable, can be non-specific, and we cannot see those deposits on ultrasound or MRI. What we can see on ultrasound and MRI are the chocolate cysts. So, however, when a woman comes with these kind of symptoms and we suspect endometriosis, we do an internal checkup which can give us some clue regarding the diagnosis, and we get an ultrasound done and an MRI if required. However, for some women, we may have to resort to a laparoscopy, which is a surgical procedure with which we can make a definitive diagnosis. Also, it can help us deal with the deposits, adhesions and the cysts, as in we can do the treatment also simultaneously. So once the diagnosis has been made, the aim is to correct or treat your symptoms. So treatment again can be challenging because there is no permanent cure. However, we have a range of options which can help you deal with your symptoms. Now, adopting a healthy lifestyle, exercising on a regular basis, eating a balanced diet, a plant-based diet, and doing some stress management can help you to deal with your symptoms in a large way. Now, depending upon your predominant symptoms, whether it is pain or fertility is a concern, what is your age, what is your medical history, and your personal preferences, we are going to choose what is the best option for you. So when we talk about pain, we have majorly two options. We deal with it medically, or if medicines don't work, then we have to go for surgery. So when we talk about medical treatment for endometriosis, it is either just simple painkillers which you have to take during the pain episodes, or it can be hormonal medications which can be given in the form of oral tablets, injections, patches, or it can also be given in the form of a intrauterine device which is called a Mirena. Now these hormonal treatment is going to shrink the deposits and to a large extent will resolve your symptoms. However, if medicines are not working, or the cysts are too big, or you're not suitable for medical treatment, then we have to go for surgery. Now, surgery also can be of two types. It can be a reparative surgery or it can be a definitive surgery. So, reparative surgery meaning we just deal with the deposits, we deal with the additions, we deal with the cysts. But it's important to understand that one surgery is not going to permanently remove endometriosis. So, you still have to be on medical treatment so that it does not come back. When we talk about permanent surgery, it is generally removal of the uterus, the tubes, and plus minus the ovaries depending upon your age and your condition. Now, this is about when we are dealing with pain. When we are dealing with fertility issues, again the treatment depends upon the severity of endometriosis. So, if it is mild endometriosis, generally we give medicines to release the egg, do a timed intercourse, and we may do an IUI. So, ovulation and induction and IUI is generally the preferred treatment. However, if it is a severe endometriosis, then going for a surgery can further hamper your egg reserve. So, going for IVF is the best option in those circumstances. So, this was all about endometriosis. So, just to summarize, endometriosis is a chronic disease. It is there is no permanent cure. It can lead to debilitating symptoms. It is don't rush into surgery. Explore all the options because one surgery is not going to remove endometriosis completely, and there are a lot of options to deal with your symptoms, and understanding the disease process helps you deal with the disease better. Thank you for listening.